Charnel. I'm going to read it, but let's see what she has to say and we'll talk about it. I am concerned for a friend who has been acting out of character. How can I approach the subject of mental health without triggering a negative reaction? I love this question because there are so many people in our lives where we want to approach them, doctor, and we don't know if we should or how to do so. So, what would you tell Charnel, talk?
So thank you, Charnel. This is a tricky question. And I think one of the things that one should keep in mind is that they know that person best. They might know how to approach them, what language to use. You might want to script out different things that you might say in your mind. The best piece of advice that I can give is to notice out loud or notice objectively, in as objective language as possible, what you're seeing. So for example, Charnel, you might say to your friend something like, I noticed you've been a little different lately. Or I noticed that you've been a bit more tired or maybe a little bit more irritable. And just say that out loud. Notice that they've changed. Notice something's different and see what they say. Just objectively noting without judgment what you're seeing. You would not say, are you depressed? Are you angry about something? Just notice out loud what the change you're seeing in their behavior without making an assumption about what may be causing it, because you might be wrong.
Absolutely. And I've heard, doctor, and correct me if I'm wrong, that one of the things never to say is, what's wrong with you? Your life is great. You snap out of this. One never knows, right? You need to listen, just listen.
That's absolutely right. And we know that depression, for example, strikes people regardless of how much money they have in the bank or how good of a job they have on paper. Depression is something that you might not see. It can look like an invisible wound where objectively it looks like everyone has everything going for them. Wonderful family, great job, big income, lots of vacations, but they're depressed. They can't experience the joy that others might feel in those situations and others who don't have it as much. So we shouldn't make assumptions about what might be causing or not causing someone to feel depressed or anxious, because everyone is different.
And I'm so glad you brought up depression because, again, sometimes we don't see the signs, and some people say teen depression is just sadness, and that's not the case. It can affect how a teenager can feel, how he can act, how he can behave, which leads me to a story from the Mayo Clinic. They put together 5 signs that your teen could be battling depression. I think this is important to watch. Let's take a watch.
It's no secret that teenagers can be moody, but research shows that ongoing moodiness often is far more serious.
Depression is much more common than most people realize. This is something that affects teenagers of all walks of life, of all backgrounds, and actually of ages from as young as 12, sometimes even younger, and up to the young adult years.
Dr. Jana Gawartz O'Brien, a Mayo Clinic pediatrician, says new guidelines suggest screening all teens for depression starting at age 12.
About half of kids are not identified with depression when they have it in the primary care setting, so we need to make sure that we're catching more of those. We can do better.
Dr. Gawartz O'Brien says parents should also be looking for these 5 signs their teen is depressed: excessive irritability or generally depressed mood, trouble sleeping or excessive sleeping, sudden severe weight gain or weight loss, a sudden drop in grades in school, and sudden loss of interest in activities they used to enjoy.
If somebody reaches out to you and says, I'm worried I'm depressed, or I'm thinking about harming myself, that is something to be taken very seriously, and that's where your primary care provider can really help.
Your thoughts on this, doctor?
I would completely agree with those 5 warning signs. Those are characteristic symptoms of depression. One of the things that I would also note is that teenagers and many adults even can't really name how they feel. They might not have the words to describe how they're feeling at the moment. They might just say bad, or they might be dismissive and abruptly say, I'm fine, but that's not the case. So I think we need to also be mindful that people might not understand what's going on with them, might not understand how they're feeling, and that a simple I'm fine should not be taken at face value, especially if there are other warning signs like those 5 other signs that are happening at the same time.
And doctor, any thoughts for parents who have had children home, obviously for maybe a year, virtual? Many have not even seen their friends. things are improving and we know that, but a lot of time has passed and an effect has been made. Any ideas for parents who have said, wow, this has taken a toll on my child? How do I get over this hump and get them back to normal?
Right, that very well might be a gradual step, especially depending on where you are in the world or in the country and what the precautions and what the rates of COVID are. What I would say is to find something that you can do, find one small step that you can take. For example, if the child has not seen their friends in a while, it might be that you plan a gathering where people are appropriately distanced and it's in your front lawn if you have one, or backyard, or in a public park. Or they begin to hang out on, a video call and do maybe they do a board game or play something fun together that brings up that joy again. And those things can be planned, and those are baby steps to sort of re-socializing people to being in play groups or being on the playground or being back at school and having some semblance of normalcy. It might mean that you have to take small steps to get there, and you can't just jump into the deep end of the pool.
And doctor, I just want to remind our viewers, if you have a question to our expert, just give us a call or send us the question via email. It's really easy to do. Our phone number, 855-796-4475. And you can email your question to questions@allhealthtv.com. You can even videotape yourself on the cell phone and download it right there on our website to the right, allhealthtv.com. We'd love to hear from you, as always. Doctor, I have a question here. How much or how little should parents share their fears and anxiety with their children? I like this question, and we just got it in from a viewer. You know how we kind of always put up a front and we say everything is fine, the sun is always going to come out, everything is rosy. How much do we really tell them? It could be a parent losing a job or finances getting a little bit more difficult. There's just so many things. What do we do?
So I would say one thing that to keep in mind is it depends on the developmental stage of the child, how old the child is. But in general, children, like most adults, kind of know when something's up. You might try to hide it as an adult that you're very fearful or concerned or anxious. But I think it would be important to find some way to convey those to your child, because it models that saying that out loud is okay. That the child, when they grow up, can learn that it's okay to be afraid of something. And it can be okay to say it out loud without the heavens collapsing and the sky falling. And that the child knows that you're in that problem solving together. Like, you're going to solve this problem and work on it as a family. And that they might have fears too, that you then telling them about your fears in language that works for you helps them to feel more comfortable expressing the things that they're afraid of, which might be some of the same things.
Absolutely. Doctor, I was reading here the CDC says some people might react to stress immediately. Others may not experience stress until later, which is something that you started talking about at the beginning of the show. Would you say this is causing an increase in PTSD, post-traumatic stress disorder, especially amongst healthcare workers, those that were on the front line? They've seen a lot.
You're absolutely right. Our healthcare workers on the front lines have seen a tremendous amount. They've seen tremendous human suffering, loss of life, death on the scale that they've not encountered before at any part of their training. They've had to make very difficult medical decisions. They've had to be at patients' bedsides while their loved ones were saying goodbye on a video call, if they could at all. And that takes a tremendous toll. And they, at the same time, were afraid of contracting COVID and bringing it home to